Today marks World Cancer Day, and according to research by the Cancer Association of South Africa, approximately 8 to 1,000 youngsters in South Africa receive a new cancer diagnosis each year. In the country, it is thought that at least half of all cases of childhood cancer go undiagnosed. Two-thirds of children in South Africa who have cancer never receive treatment at a specialized facility. A child diagnosed with cancer should ideally be treated at a pediatric oncology unit. We speak now on the significance of the day and possible interventions with Paediatric oncologist Dr Thandeka Ngcana. Doc, thank you very much for your time this morning. How does cancer present itself to young people?
Thank you, Gugu. There's no specific presentation of cancer in children and young people. However, there's been some research work by one of our South African oncologists, like international research work, Dr. Stelios Poyages, where he described the danger signs that parents should look out for early warning sign for childhood cancer. And as you had alluded earlier, is a lot of children, or a bulk of our childhood population is missed because people are not aware of the early danger signs of childhood cancer.
What then should people look out for?
So the St. Julian signs, there's a group of them. Either number one, in a growing child, if there's any developmental delay or developmental regression. So in other words, if a child has been sitting, all of a sudden he's not sitting, or if the child is not developing as they should. Other signs that you should look out for would be unexplained fevers, lumps and bumps that are unexplained. One of the biggest signs as well is easy fatigability, so a child gets tired very easily, and easy bleeding and bruising, which are one of the major warning signs, to just mention a few. But if you do go look up on the Cancer Association website or any website and you look for St. Julian danger signs, it specifies the top major danger signs that you look out for in children.
What is your advice to parents, right? So if you are not able to visit a pediatrician, what then do you do? Do you take your child in once a year, twice a year, every 3 times a year?
My advice to any parent is, if there's anything that you find abnormal or anything that you find worrying or something that is new in your child. And when I'm referring to parents, I'm also referring to educators, because the reality of our population is our kids, especially in the low-income, middle-income communities, spend most of their days at the school, and the go-to person who interacts the most with the child is the teacher, is to go to a primary health care facility and seek help. Help seeking is a very important thing. Don't wait until you have bigger problems. So if you're worried about something, we have primary health care facilities in the country. Seek help and raise your concern to these facilities.
Please finish your thought.
The Chalk Foundation has got a toll-free number. It's 0800 555 So you can call that number and they can advise you and direct you if you have a concern.
So that 2/3 of children in the country who have cancer never receive treatment at a specialized facility tells us what?
Number one, the biggest issue with our poor outcomes or poor prognosis in childhood cancers in South Africa at the moment is most childhood cancers are treatable and curable. However, this is dependent on diagnosis and referral. So one major issue is diagnostic lag time. This diagnostic lag time, one of the bigger contributors is education. So it's important that we have platforms like this or shows like this where communities, healthcare professionals are educated about these danger signs, what to look out for, and how to refer. The other issues is the limited access to pediatric oncology services, especially in sub-Saharan Africa, where even some of our neighboring sub-Saharan African countries, the children have to be transferred to South Africa for treatment.
How do we make it better? That's rather scary, no?
Education. So the more people get educated, the more people get familiarized that there is an entity called childhood cancer. The more children are referred earlier, and the more we get to treat and cure.
Paediatric.
The other issue as well with the education, we also need to understand that the concept of cancer, especially in an African setting, is there are certain entities where our own cultural practices and beliefs also complicate treatment modalities that we have in cancer. So we need to acknowledge that there are cultural differences, cultural practices, and we also need to educate our communities. And how do we educate them? It is easier to get educated by someone you can identify with. So by getting volunteers being educated, going out to the communities, teaching people, allowing people to tell their story that cancer in children is curable. That would actually help a lot with cure rates and picking up children with childhood cancers.
And if anybody is interested in that, I'm assuming they can head on over to the CHOC Foundation.
Yes, they can head on CHOC Foundation, Cancer Association. There's a lot of NGOs that are involved in childhood cancers that are our biggest supporters. And if you look on the CHOC website, the danger signs are there.
Pediatric oncologist Dr. Thandeka Ngcana. Thank you very much, Doc, for your time this morning.